Prasanthi Hospital Oration 2020, citation in honor of Dr. Mrugesh Vaishnav, MD, Indian Psychiatric Society, Telangana State Branch, in its 6th annual conference, is honored to have Dr. Mrugesh Vaishnav deliver the prestigious Prasanthi Hospital Oration 2020 during the annual conference of Indian Psychiatric Society, Telangana State Branch. Dr. Mrugesh Vaishnav was born on 6 December 1955 in Rajanpur village of Banaskantha district of Gujarat state to Mrs. Pramoda Vaishnav and Mr. Davidar Prasad Vaishnav. His father was the judge of cooperative tribunal. He did his MBBS from BK Medical College, but in 1978 and DPM from same college in 1981. He did this from the same college in 1982. Dr. Mrugesh Vaishnav is the director of Samvedna Happiness Hospital, the first private scientific setup of Western India accredited by the NFES now. He is also the director of Institute of Psychological and Sexual Research. He holds various prestigious posts like the advisor to SARC Psychiatry Federation, direct counseling member of the Indian Association of Social Psychiatry, consultant to the Family Planning Association of India, and the direct counseling member of Council of Sex Education and Parenthood. Dr. Mrugesh Vaishnav has been an leadership post as president of Indian Psychiatric Society 2019-2020, direct counseling member of Indian Psychiatric Society 2015-2017, direct counseling member of Indian Anthropos Society 2019, direct counseling member of Indian Private Psychiatry 2008 to 2010, president of Community Psychiatry Section IPS 2017-18, vice chairman of and the organizing secretary AV IPS Western Branch in 2009, chairman of Spirituality and Mental Health Section IPS 2008 to 2010, chairman of Sexual Medicine Task Force IPS 2004 to 2008, founder president of Indian Association of Private Psychiatry 2002 to 2006, editor Archives of Indian Psychiatry, the official journal of IPS Western Branch 2000 to 2004, president of Indian Psychiatric Society GSB in 2006 to 1986 to 1987. His areas of interest are sexual medicine, mood disorder, schizophrenia, geriatric and addiction psychiatry. Dr. Vaishnav is the recipient of Gujarati and Hindi Sahitya Academy Award, Mother Teresa Sadbhavna Award, IMA Medical Achiever Award, LPSA Oration Award, Oration Award at Sexology Conference, MR Oration Award, BA Mehta Oration Award, IAPP Amit Bora Oration. He has 44 academic publications to his credit and has authored 15 books. He has written over 3,749 newspaper articles and given over 457 academic lectures and seminars. He has also given 1,504 public education lectures and seminars. The Indian Psychiatric Society Telangana State Branch is pleased to honor Dr. Mrugesh Vaishnav with the Prasanthi Hospital Oration 2020. Dr. Minhaj Nasir Badi, Honorary Secretary, IPS Telangana State Branch, and Dr. D. President, Indian Psychiatric Society, 6 September 2020, SGS Medical College, Mehboob Nagar, Telangana State. This is started in I'd like to request Dr. Mrugesh Vaishnav to give his stages oration. Thank you very much.
Thank you, Dr. Maniyar, for the excellent and kind words. I am humbled and delighted to be nominated for prestigious Prasanthi Hospital Oration Award by Indian Psychiatric Society Telangana branch. I am equally thrilled to receive it by my senior colleague and 45 years old friend Dr. Rajesh Maniyar. At the outset, I thank the legend of Indian psychiatry, Professor P. Raghurami Reddy, President Telangana Psychiatric Society, Dr. J. Mayurnath, President IPS South Zone, Dr. P. Kisan, Vice President cum President-elect, Indian Psychiatric Society Telangana branch, Dr. G. Jagannath, immediate past President, Dr. Keshav Rao, Honorary General Secretary, Dr. Minaz, Organizing Chairman, and my dear friend, Dr. K. Ashoka Reddy, all other senior stalwarts of the Telangana Psychiatric Society, dear colleagues. I hope you and your family are healthy and safe during these uncertain and unprecedented times of COVID-19. I wish I would have been in Hyderabad with you, but the big corona factor has successfully kept us apart. Not only that, but the recent corona factor in my family has kept me apart from Chairman Dr. Rajesh Maniyar, and that's why we are sitting at a distant place. So, accepting the situation as new normal, I am here to address you virtually. Well, over the last few months, the world has seen the emergence of new public health threat, the coronavirus 2019. It has brought the world down to its heels. During this once in a century pandemic, as Bill Gates says, human races across the globe is facing massive unprecedented challenges disrupting essential aspects of public, economic and private life. The psychological aspect, the psychological offshoots of COVID-19 such as depression, anxiety, post-traumatic stress disorder, sleep disturbances are being studied in depth. There is a dearth of literature on sexual well-being and sexual practices during this pandemic. The love, sex and relationship is neglected in this pandemic by medical researchers and healthcare providers, as usually it happens with sexuality. Why love and sex is so important during COVID-19? Because the physical distancing, travel restrictions, the high human-to-human transmission rate, misinformation and uncertainty about the sexual routes of transmission for SARS-CoV-2, the fear about love, intimacy, sexuality, safe sexual practices and relationships have increased significantly, which requires to be addressed scientifically. Sex is the most important but least addressed aspect of the human physiology, biology, psychology, sociology and medicine. As a result of that, a large number of people are suffering in silence. Hence, I'll discuss the clinical and research aspect of the love, sex and relationship in this difficult time of COVID. Since the classical bubonic plague in 13th century, as we all know the history, the world has faced pandemic time and again, disrupting social structures, surprising much literature is focused on the psychological and construct of the sexuality during this deadly disease of bubonic plague. A poetic description of plague mentions fear of infection disrupting love and lives. They mention couples being separated in room and even they were not allowed to talk. It was commented by Albert Camus that a loveless world is a dead world. The plague makes us crave more for love and the arms of our loved ones. Now, the questions people ask, the literature related to sexual health and current COVID-19 pandemic is still in the infancy. The global lockdown led to marked physical and social distancing, and implications are almost chronic. We do not know when this pandemic will end. Unfortunately, sexual well-being is often neglected at the face of more significant immediate physical concerns. Given the importance of sexuality in people's lives and its relationship with quality of life and psychiatric disorders, physicians need to stay sensitive to this issue. They should routinely ask and screen the patients for sex-related complaints. Now, what the questions people ask to me are, can we have sex with keeping 6 feet distance? Is it possible? Can you kiss your loved one? Can you date someone? Is pandemic going to change our sex life and making it more mechanical and digital? Can we have sex wearing the mask? What about washing the hands? What now? I had corona and now I'm out of it. 15 days have passed. When can I resume the sex life? So many clinicians asked me that none of their patients have asked such a question to them. Why? The social stigma attached behind the sexuality and the very socio-cultural expressions, the dictum that holds true clinically is that you don't ask and they don't tell, so you should ask. In practice, there are many questions, dilemmas and confusions about sex and sexuality. There is a stress and sex connection. Many people will say that when relatives are dying, when friends are dying, who will think about sex? But there is a stress and sex connection. Sex is a great way to relieve the stress. I will say about our own research during the earthquake in 2001, when sexual practices were more and there were more erectile dysfunctions. The benefits includes release of endorphin and other hormones that elevated mood. That's why it's a stress reliever. It's also a great exercise, which itself is an effective stress reliever. Stress can also keep us from getting in mood and was not being able to perform the sexuality, that will be performance anxiety. Now, what is the role of senses in the sexual arousal? From time immemorial, scientists, sociologists, artists, writers, etc. have accepted that human senses have very important role in sexual arousal for male and female both. Touch, sight, hearing, smell, taste. These are the 5 senses which plays the important role in enhancing and turning on the sexual pleasure. If these sensory pathways are blocked because of the inhibitions, sexual preoccupation, sexual myths and misconceptions, or such threats of the pandemic, the results into sexual dysfunction and we fail to initiate, maintain or enjoy the sex and sexuality. This pandemic has profound effect on all the 5 senses. Some have viruses, they have lost ability to smell and taste. We all see images of the crowded hospitals, body bags, lonely funerals with mourners, and we hear a new urban soundtrack. The traffic is muted and sirens scream through the stillness. So there is a craving for touch. For many many years, for many people, touch has become the rarest quarantine provisions. We are lucky to be alive, says those craving for the physical contact. But we don't feel so human without the touch. Not knowing when they will be able to get back to the hugging, cuddling and sharing a bed with someone makes craving more acute, as you have seen in the bubonic plague research. Some describes the lack of touch as its own sensory experience, a dull neck, a skin that hurts, a hole in the pit of the stomach, like butterfly in the stomach. Touch I'm sorry. The touch increases oxytocin in the brain. The touch increases endorphin in the brain. Touch decreases cortisol in the brain. Now in this way, the touch helps us. Oxytocin, you all know, is a cuddle hormone. It's a love hormone. Even playing with your dogs can cause an oxytocin surge. Oxytocin can also intensify memories memories of the bonding gone bad, such as in cases where men have poor relationships with their mother. Touch is important for cognitive development of the monkeys too. Henry Frederick Harlow, in his psychological experimentations, proved that touch is important for the cognitive development too. Now let's have a refresher course for the coronavirus spread. We all know that the virus is carried in respiratory droplet transmitted by sneezing and coughing. If people are nearby, droplets might land in their mouth or nose or possibly be inhaled. Viral particles called aerosols may float to drift in the air when infected person talks, sings or breathes. People nearby may inhale aerosols. Research shows that the virus can live on surface and may be sprayed when the person touches those surfaces, then touches their face. The virus may be shed in saliva, semen and feces. Whether it is shed in vaginal fluid, it's not known. Kissing can transmit the virus, so you have to add the kissing. Transmission of virus through feces or during the vaginal or anal intercourse or oral sex appears to be extremely unlikely at this time. The fear and frustration for intimacy, because any form of human to human contact can spread the virus. As a result of that, people are afraid of human to human contact in this pandemic. This further generates fear and frustration related to the intimacy. It's all the more for frontline workers against the COVID-19 who self-quarantine themselves to prevent interactions with their families. Those who return to their spouses have expressed marked guilt, fear and apprehension. So how safe intimacy is with your partner? Many forms of intimacy require a closer distance than 6 feet, which is mentioned by the CDC. Both you and your partner are healthy and feeling well, are practicing social distancing and have had no COVID-19 exposure, then you can have touching, hugging, kissing, etc. So sex is permissible in that case. Now to study these in detail, from the Indian Psychiatric Society, the review board approved a study, that is a sexual functioning during the lockdown. It's an online survey which was carried out by several researchers, mainly by the Sandeep Grover, me, Adarsh TSS, Ajit Avasti and many others. Now the aim was to study and to evaluate the impact of the lockdown on the sexual functioning. It was an online monkey survey. Study design, this study aimed to evaluate the impact of the lockdown. Yes, comparison of the sexual activities prior to and during the lockdown period. Here is the comparison in detail. I am not going into the detail of the chart, but I'll summarize the findings afterwards. There is impact of lockdown in the relationships with the partner. We have surveyed very much improved, somewhat improved, not changed, somewhat worsen, very much worsen. These were the scales. Correlation of sexual functioning with psychological morbidity. That's also we have studied. Now we'll see the reasons. The mean change of the participant, the mean age of the participant was 14.5 years, with the majority being males, that is 385. The participants reported that lockdown led to reduction in the frequency of fondling, caressing, touching or kissing partner when not indulged in sexual intercourse, and reduction in the frequency of sexual intercourse. Majority of the participants reported improvement in the overall relationships, communications with the partner and interpersonal conflict. Only about 2/5 of the participants reported engaging in sexual intercourse more than twice a week. About 1/5 were found to have psychiatric morbidity, with 14.2% screened positively for anxiety, 14.8% screened positively for depression, 8.7% screened positively for anxiety and depression both. In both the genders, presence of depression and anxiety were associated with lower sexual functioning in all the domains of sexuality. Now the conclusion was that lockdown lead to reduction in the frequency of sexual intercourse and reduction in the frequency of intimacy in the form of fondling, caressing, touching or kissing partner when not doing sexual intercourse. However, lockdown led to the improvement in the overall relationships and communication with the partners and reduction in the interpersonal conflict. So, there are challenges in the practice of the sexual medicine in the time of COVID in China. A survey from China says that 44% of the participants reported a decrease in the number of sexual partners. 37% of the participants reported a decrease in the sexual frequency. Multiple regression analysis showed that age of the partner relationship and sexual desire were closely related to sexual frequency. Individual with risky sexual experience, there was a reduction in the sexual behavior. Similarly, challenges of sexual practices in United Kingdom. In this 868 sample survey in the United Kingdom, interventions to promote sexual activity during the COVID-19 pandemic may mitigate some of the detrimental health consequences in relation to self-isolation and should target those with the lowest level of sexual activity. Now, what are the probable love, sex and relationship issues during the COVID-19 pandemic? First can be the sexual abstinence, with the people observe that no need, celibacy can be practiced. Second is coercive sexual practices, intimate partner violence. There are numbers of incidences of intimate partners violence and incest which are reported in daily newspapers and in the criminal record. There is non-compliance to the precautions by some. There is increase in the paraphilia. There is a disinterest in the sex, unhealthy use of the technology, that is the pornography, addictions, use of the dark website, as per the research across the globe mentions. Over and above that, there are interpersonal issues. Over and above that, there are interpersonal issues, extramarital affair, marital discord, the rise in the sexual disorder like erectile dysfunction, premature ejaculation, arousal disorder. There is a high risk sexual behavior or increase the viral spread because of this. The sexualized coping behavior which many used was uncontrolled use of pornography. Worldwide increase in the pornography use 11.6% during the first 15 days of the lockdown only. In a survey by Jung et al. Conducted during the height of the lockdown in Germany from 1st April to 15th April, showed 5% responses reported internet partner violence. Prevalence of the internet partner violence during 1 month of the lockdown was also more that was reported. Now coming back to the question, can I have sex during the COVID-19 pandemic? Say no to sex with COVID-19 symptoms. If COVID-19 is not, though COVID-19 is not a sexually transmitted infection, however, it can be passed on through kissing and close contact, including having sex. If you or your partner are displaying symptoms of the COVID-19, that's a dry cough, temperature, or difficulty breathing, you should limit all close physical contact to stop the spread of the virus. This means avoid physical intimacy such as kissing, cuddling, anal, vaginal, or oral sex. Now, non-physical contact sex. The world over research says that you are your own sex best. You are on your best sex partner. That is masturbation. So you can practice the masturbation. There is no question of the 6 feet distance. You can also use sex toys, or you can rediscover the art of the phone sex, of the sexting, and of the webcam sex. So this is about the digital love. I'll just run through which people had practiced. I think there is no run through. The video cannot be run, I think so. So I'll produce, this was about the digital love. The video cannot be run. Okay. Okay, no issue. So sex with someone you live with. Your wife can be your best sex partner. If you live with someone in the same house as a regular sexual partner and both of you have no symptoms, then you can continue with the sex. If your partner is having sex with other people, you don't live with the partner, then increases the risk of the COVID-19. Now, limiting the spread of sex during COVID-19, what should we do? Avoid kissing and exchanging saliva with anyone outside of your household. Avoid sexual activities which includes licking around the anus. Use condom or dental dams to reduce contact with saliva. Take a shower and wash your hands and body thoroughly with soap and water, both before and after the sex. If you have sex toys, wash this thoroughly with soap and water and do not share them with others. Consider sexual arousal techniques that don't involve physical contact, like talking, mutual masturbation while physical distancing. Limit your physical interactions by reducing the number of sexual partners you have overall, and or at the same time you can reduce the risk of the coronavirus. Now, this is the best opportunity to explore your sexuality, because those who are having sexual problems like erectile dysfunctions, premature ejaculation, arousal dysfunctions, or orgasmic dysfunctions, to all of them be advised to explore the sexuality in the behavioral therapy session stepwise, and this is an excellent time to explore it rather than saying no to the sex. Maybe we should encourage the people to use this time to explore their sexuality, to educate themselves about sex, and to learn more about their bodies, so that when we come out of this pandemic, perhaps we will be in a position to have even better sex than we were having before. So lastly, the carry home message is: love and sex before and after COVID-19 pandemic is very important. Lockdown led to reduction in the frequency of the sexual intercourse. reduction in the frequency and intimacy in the form of fondling, caressing, touching or kissing partner when not doing sexual intercourse, identify love, sex and relationship issues during COVID-19 pandemic in your clinical practice. Sex during COVID requires cautions. You are your own best sex partner. Someone with whom you live is also a good sex partner. Avoid sex with stranger. Use sex toys and virtual sex as new normal, but not the pornography. Role of senses, particularly touch, is very important, and it should be taught to post-COVID dysfunctional patients. Sex therapy will have wider scope after the COVID-19 is over. Accept the new normal and adjust with sexuality too. I thank you. Thank you, the chairperson, Dr. Rajesh Manyar. Thank you, Dr. K. Ashok Reddy. Thank you, Dr. P. Kisan. Thank you, Dr. Mayurnath. Thank you, Dr. Jagannath. Thank you, Minas. And thank you, all the members of the Telangana Psychiatric Society, for giving me such an honor in your society. Thank you. Namaste. Goodbye.